In this part, I'm going to discuss basic anatomy of the brain on CT, and I'm going to use an approach going from outside to inside. So I'm going to start with discussing the skull anatomy. We're going to talk about meningeal anatomy, despite the fact that the meningeal layers cannot be clearly seen on CT. It is important to have an idea on the anatomy of the meninges of the brain. Then we're going to talk about the cerebrospinal fluid spaces of the brain, like the cerebral sulci, the ventricles, and the basal cisterns. And lastly, we're going to talk about the anatomy of the brain parenchyma, both gray matter and white matter. So let's start with the outside. Let's start with the skull. To examine the skull on a CT, it is self-evident that we have to use a bony window. And if we magnify part of the skull like this, we can clearly see the several components of the skull. We can see that the skull consists of a very thick inner layer called the inner table, a thick inner cortical layer, a very thick outer cortical layer called the outer table, and in between we have trabecular bone called the diploe. If we show you a close-up of another part of the skull, we see these lines coursing over here, or those fractures. Well, they aren't, and you will see lines like those on every CT of the skull. These are the so-called sutures. These are the places where the several bones of the skull have ossified with one another, so to say, and you can distinguish them from fractures because, well, you have the symmetry. There's often a similar line on the contralateral part of the skull, and they often have a sawtooth appearance, running a bit zigzag through the skull, and have sclerotic margins. The sutures can better be seen on three-dimensional reconstructions of the skull, and on this image we can clearly see the coronal suture. Over here we have the squamous suture, and here we have the lambdoid suture. And these sutures divide the several bones of the skull from one another. The biggest bone located between the coronal suture, squamous suture, and lambdoid suture is the parietal bone. Then we have the occipital bone at the back of the skull. The temporal bone is located at the side underneath the squamous suture, and at the front we find the frontal bone. We mostly have just one frontal bone, but in some cases there's a persistent metopic suture dividing the frontal bone in two parts. We have two parietal bones, however, and these are divided by the sagittal suture, which is best seen if you look at the skull from above. If we look at these three-dimensional reconstructions, and we are looking at the skull from above now, we see over here the coronal suture, here we have the lambdoid suture, and there is the sagittal suture, and we see two large parietal bones on each side of the sagittal suture. So that concludes the discussion of the skull. Let's move inside. Immediately underneath the skull, we find meninges. And what are the meninges? These are very thin membranes covering the brain. We have the very thick dura mater, which is a very thick meningeal layer closely opposed to the skull, and it folds inwards, forming the falx cerebri. And in the falx cerebri, both at the back and at the front, we find the superior sagittal sinus. Immediately underneath the dura mater, we have a thin meningeal membrane, the arachnoid. The arachnoid is closely connected to the dura mater and follows the contours of the dura mater, so it does not run inside the sulci. That is something the pia mater does, which is the thinnest meningeal layer, and is immediately located above the brain surface, following the morphology of the cerebral gyri. Between the arachnoid and the pia mater, we have a space containing cerebrospinal fluid called the subarachnoid space. In this space, we have, as said, cerebrospinal fluid, but we also find arteries and veins and some kind of trabecular connective tissue meshwork connecting the arachnoid with the pia mater. Everything that stands or is written on this slide has already been said. So we start with the very thick dura mater immediately underneath the skull. Then we have the thin arachnoid mater in close contact with the dura, and the pia mater located immediately above the brain surface. If we look on these images, we can see one specific meningeal structure. So most of the meninges cannot be seen on CT of the brain, except for the falx and the tentorium. Now, what is the falx? We see this very thin, slightly hyperdense structure running in the longitudinal fissure of the brain. This is the falx cerebri, and the falx cerebri is, as already said, an infolding of the dura mater along the midline in the interhemispheric or longitudinal fissure. We can also see it on these images a couple of slices lower, and notice these somewhat triangular structures located in front and at the back of the falx. These contain the superior sagittal sinus, which is surrounded by dura and located inside these dural layers. So superior sagittal sinus. Then we have a second dural layer that can be seen on CT, and that is the tentorium. The cerebellar tentorium is an infolding of the dura mater, basically separating the brainstem and cerebellum located underneath it from the occipital lobes of the cerebral hemispheres and the rest of the brain. So the Tentorium cerebelli is a bit tent-shaped, but has an opening called the tentorial notch. And this opening is made, or this is an opening for the midbrain. And it's an important opening because, as we will see when we talk about brain herniation, in cases of increased intracranial pressure, or when there's a space-occupying lesion located in the supratentorial brain compartment, this can lead to herniation of brain parenchyma through the tentorial notch, causing compression of the brainstem. On this coronal image, we can see both the falx and tentorium, and we see that these are connected with one another or continuous with one another. The falx cerebri is located in the midline in the interhemispheric fissure and separates the right from the left cerebral hemisphere. Then we have the tentorium cerebelli, which separates the cerebellum from the occipital lobes of the cerebrum. Now let's move on to the cerebral sulci. We're now talking about the cerebrospinal fluid containing spaces of the brain, and the cerebral sulci belong to those spaces. What are the sulci? Well, let's first answer the question about the gyri of the brain. If you look at the brain surface, it is not smooth. The brain has a very convoluted appearance because it consists of folded cortical tissue. And the cerebral cortex is folded because, due to this folding, the brain surface area is exponentially increased. So we have a lot more room for cerebral cortex this way. These folds or ridges are called gyri, and sulci are clefts or furrows filled with cerebrospinal fluid surrounding the gyri. If we have very deep or important sulci, we call those fissures. And there are two fissures you should definitely know. The first one would be the Sylvian fissure, and the Sylvian fissure can be seen over here. It is the fissure separating the frontal and the parietal lobe from the temporal lobe. And over here we find the insular cortex underneath the Sylvian fissure. A second very important fissure is the interhemispheric fissure. The interhemispheric fissure is the fissure separating both cerebral hemispheres containing the cerebral falx, a structure we already talked about. This is the Sylvian fissure in the sagittal plane, and we clearly see how it separates the frontal lobe and parietal lobe from the temporal lobe located underneath it. There are a lot of sulci in the brain, and there is a separate video on this channel discussing cerebral cortex anatomy, in which the anatomy of the cerebral gyri and sulci is discussed in great detail. Now, definitely check it out. It's less than an hour long, but needless to say, I won't discuss cerebral sulcal and cortical anatomy in detail in this video. Just believe me when I tell you that this is the central sulcus, which separates the frontal lobe from the parietal lobe. And over here we once again see the Sylvian fissure with the temporal lobe located lateroinferiorly from it. Here we see the base of the frontal lobes, or the basal aspect of the frontal lobes, and here we have the occipital lobes at the back. There are several sulci and fissures which separate these brain lobes from one another, but at other places these do not exist. For instance, there is no sulcus clearly separating the temporal lobe from the occipital lobe. So if you have a lesion in this region, it's definitely not wrong to call this the temporo-occipital transition area, for instance, because there simply isn't a clear border between these two brain lobes. Let's now talk about the ventricles, which are cerebrospinal fluid hollow spaces located centrally within the brain. And we have 4 of them. We have 2 lateral ventricles, as you can see here, and running in the middle between both lateral ventricles is a very thin membrane called the septum pellucidum. We also see that there are soft tissue structures located in the lateral ventricles. This is choroid plexus, and choroid plexus is responsible for producing cerebrospinal fluid. On this image over here, we clearly see the lateral ventricles, and we also see calcified plexus located in the trigone of both lateral ventricles. And then we have a new structure, the third ventricles, with on both sides the thalamus. The third ventricle, or the third ventricle, communicates or is continuous with lateral ventricles through a small opening, well, basically 2 small openings called the foramina of Monro. Let's first look at the coronal image, this one over here. Here we see the frontal horns of the lateral ventricles, and this is the third ventricle. The small opening connecting them is called the Monro foramen, as indicated by the arrows over here. And we can also see it on the axial image, of course. But let's magnify it to make it a bit more clear. Here we have the septum pellucidum, and this somewhat nodular appearing thickening are basically the 2 fornices. The fornix is a white matter tract which runs along the inferior surface of the septum pellucidum and connects the hippocampus with the mammillary bodies, or with the ipsilateral mammillary body. It's not that important, just so you know what this structure is. And here we see the Monro foramen connecting the lateral ventricles to the third ventricle. This is an important region to examine in a patient with hydrocephalus, because in a patient with hydrocephalus, it's important to look for the cause of the hydrocephalus. There are many potential causes, but an obstruction of the cerebrospinal fluid circulation can be one of them. And that obstruction is most likely to occur at those passageways that are the most narrow, like the Monro foramen between the lateral ventricles and the third ventricle. The last ventricle we need to discuss is the fourth ventricle, located infratentorially. We can clearly see it here on the axial image between the brainstem and the cerebellum, and also on this sagittal image. Once again, we have a very narrow passageway connecting the third ventricle, located over here, and the fourth ventricle. And this is the cerebral aqueduct. This plate you can see posteriorly from the cerebral aqueduct is the tectal plate, containing the superior and inferior colliculi. The cerebral aqueduct is sometimes also called the Sylvian aqueduct, and is also one of the areas you definitely need to scrutinize in a patient with a hydrocephalus to exclude an obstruction at this specific point. What are the basal cisterns, or what are cisterns? Well, we talked about the subarachnoid space. When the subarachnoid space is very wide, not pathologically wide, physiologically, but very, very wide, we call that a cistern. And we mainly find cisterns in the basal brain area. There are a lot of them. I'm not going to discuss the terminology of each and every cistern there is in the brain, because in daily radiological practice, you don't really need an information. Very important are these, located at the level of the mesencephalon. I magnified this a bit. This one looks a bit like a Star of David and is, as a consequence, called the pentagonal cistern. This is not a correct anatomical term. This is basically a collection of several cisterns, but because combined they have this particular shape, we call them the pentagonal cistern. and the cisterns located around the mesencephalon or the perimesencephalic cisterns. Why did I single these out? Because if a patient has a brain herniation through the tentorial notch, something I already talked about, the basal cisterns will become narrow or even completely effaced. So this is also an anatomical region you definitely need to inspect on a CT of the brain. Let's move on and let's now talk about the brain parenchyma. The brain parenchyma consists of two major components, gray matter and white matter. And when gray matter is located at the surface of the brain, we call it cerebral cortex. The cerebral cortex is the layer of gray matter which is organized in folds or gyri along the brain surface, and it contains the neurons. Because it contains more cells than white matter, it is relatively hyperdense compared to white matter. The white matter is located underneath the cerebral cortex. It contains for the most part, myelinated axons of the neurons. It contains less cellular elements, and as a consequence, a bit more water, and is a bit more hypodense compared to gray matter. It's very important you see that difference. You see the difference in density between the cortex and the white matter. We call this the gray-white matter differentiation. And if it is absent, it is a sign. If it is absent, it is a sign of pathology. But more on that when we talk about pathology. When it comes to gray matter, I talked about the cerebral cortex, located on the brain surface, organized in folds or gyri, but we also have islands of gray matter located deep within the brain parenchyma. We call those deep nuclei, collection of gray matter structures deep within the brain. And there are a few you should know because they are visible on a CT of the brain. Let's magnify this image a bit. They are located in the region of the lateral and third ventricles, and we can recognize three structures. This is the head of the caudate nucleus. This lens-shaped structure is the lentiform nucleus, consisting of two nuclei, the putamen and globus pallidus, but we are not able to distinguish them on a CT of the brain, and this is the thalamus. The caudate nucleus and lentiform nucleus belong to the so-called basal ganglia, a group of deep gray matter structures which play, amongst others, a role in movement in the extrapyramidal symptom. So, if you have a lesion in the basal ganglia, this can lead to movement disorders. The thalamus, on the other hand, does not belong to the basal ganglia, but is a structure, basically a collection of nuclei, more than 100, 130, I believe. It is basically a relay station for the brain. All information that enters and leaves the brain at one point goes through the thalamus. Well, not all information, but let's say most of the information. And the thalamus has a tendency to kind of modify it a little bit and direct it and send it in the right direction. If you looked carefully at the previous image, you will have seen that between these deep gray matter structures, there was also white matter present. This white matter, which has the shape of an angle, is called the internal capsule. The internal capsule is not one white matter tract, it's basically a very concentrated collection of white matter tracts, making it a very important structure. If I magnify this a bit, you can see that the internal capsule has two components. It has a posterior limb located between the lentiform nucleus and the thalamus, and it has an anterior limb located between the head of the caudate nucleus and the lentiform nucleus. And the point where they meet is called the genu, or the knee of the internal capsule. When it comes to the rest of the brain, well, when it comes to white matter anatomy, you really need diffusion tensor imaging to visualize the separate tracts. There is the white matter tracts of the internal capsule have a tendency to fan out at the superior level to the rest of the brain. And this fanning out of white matter is called the corona radiata. So it's basically a gathering of white matter tracts connecting the internal capsule with the rest of the brain. And the centrum semiovale is basically a term that is given to the white matter bulk, as you can see it on imaging at the level above the lateral ventricles. So the corona radiata cannot really be discerned separately on a CT of the brain, but it is roughly located in the periventricular white matter along the lateral ventricles above the level of the internal capsule and underneath the level of the centrum semi-ovale. And something we can also see on this image is the white matter of the corpus callosum. The corpus callosum is the white matter tract connecting both cerebral hemispheres and is basically better seen on sagittal images. On this mid-sagittal image of the brain, we see the corpus callosum over here. It is very thick and is basically the thickest white matter tract, basically a white matter commissure connecting both cerebral hemispheres. It consists of a genu, a truncus, and a splenium, and this small triangular shape over here is called the rostrum. We're almost through with our discussion of brain anatomy on CT. Maybe I'd just like to point your attention to the pituitary gland, located over here, best seen on a mid-sagittal CT image and located in this depression in the sphenoid bone called the sella turcica. We haven't really talked about the infratentorial structures, the brain structures located underneath the cerebellar tentorium. I'm just going to do it very briefly because here is the tentorium cerebelli. What we find there is the brainstem and the cerebellum. The brainstem has several components. Let's look at the sagittal image. Posteriorly, we have the cerebellum. And then when it comes to the brainstem, we can recognize the superior midbrain. Then we have the pons, and finally the medulla oblongata connecting the brainstem with the cervical spinal cord. Now that we know the basics of CT and CT interpretation, as well as standard brain anatomy, we are ready to dive into brain pathology on CT.